Have you ever had a new patient come in and say, hey, listen, I just want to come in for maintenance care. I just want to come in once a month, or I just want to come in once a week, or whatever. Yeah, most of us have had that, especially chiropractors. If you don't know me, I'm Dr. Russ Rosen, and I help natural healthcare providers like you thrive in a care versus care, true optimal health model. I was having this conversation earlier today with a coaching client of mine. So I just thought that I would share it because I think it's something that happens, and there's really a great way to handle it, and there's a couple of ways to really blow it. So again, usually this can happen for chiropractors because we do a lot of maintenance work. I coach naturopaths, osteopaths, acupuncturists, holistic MDs, et cetera, et cetera. It can happen too, but more often with chiropractors. So the classic thing we can do is blow it. And we blow it by saying this. Um, okay. Or we can blow it by saying, look, I'm the doctor, I'll tell you what you need. Or look, we don't do that here. Or look, I'll tell you what I think is best, but you can do whatever you want to do. Any of those blows it from my perspective. Now, I understand if you're the type of doctor that says they need X amount of care and they only want Y, so less care, I won't do that in my office. And I honor that. I don't have any problem with that. I just wouldn't start there. I would meet them where they're at, and then I would help them understand the truth about what's actually going on. If you then get them there and they recognize it, but they don't want what you offer, that's fine. Let them know that you'll refer them out. Okay, so now this conversation can apply to somebody later in care who, do you think they should go to twice a week and they want to go to once a month or something like that? But let's just imagine it was a new patient. So if it's a new patient, I'm going to do my my normal visit one process with them. I'm not going to argue with them or fight with them and say, no, we don't do that. And I'm not going to go, well, okay, well, if that's what you want, then let me just adjust you and I'll see you in a month. You're a doctor, for crying out loud, right? That's a horrible thing to do from my perspective. What I want to do is I want to just acknowledge them. They might have some stress around saying that to me. They may have been to somebody before that has said, my way or the highway, or try to sign them up for a big program, but they didn't understand why, or whatever. So I'm just going to de-escalate the situation by saying, fantastic, great to meet you. So glad that you've had wonderful care in the past. Come on over here, let's see what's going on. That's it. Just acknowledge it and it de-escalates the situation. There's nothing to fight against. There's nothing to push here. Now, the next thing that I'm going to do is I'm going to do a thorough consultation. Just like anybody else, you're a doctor, you need to know what's actually going on. Then I'm going to do a thorough examination. Now, if I find out during the examination that there's more than meets the eye, I need to point that out during the examination. I know that you'd like to just come in once a month, and I'm happy to do that if you are. But with what I see going on, it appears that there's more than meets the eye, and then start to point out what's going on. Most people, when they see what's actually going on, they'll actually want to do something about it. But again, it's always up to them and or if you choose not to work with them. Now, obviously, if you agree, wow, you're doing great. You were seeing a wonderful chiropractor. You were just seeing Dr. Russ Rosen, and he's amazing. And therefore, once a month, yeah, you're doing great. That's all you need. Great. Then you would let them know that. But more often than not, if you're a chiropractor, they're coming from someone who's been pounding down the high spots. They don't understand what a subluxation is at all versus a compensation. They're just, if you're in pain, come. If you're not, don't. That kind of thing. And for you, you have a lot to show them. You have a lot to offer them. Now, in my world, in my way of testing, I'm going to be able to show them that although you feel good, you're not functioning at your optimum. So we use the path to health. If you want access to this, let me know, and I can send you over to the club for free a month, and you can get one of these for free. But I'm going to help them understand the difference between feeling good and functioning at their optimum, between feeling good and actually being healthy. That's what I need to help them understand. I got to find out what they want in relationship to what I could truly do for them and then show them how to have it. If that's all they want, far out. But most of them don't know what I have, right? They go to the store and they say, vanilla or chocolate? And I go, I have 31 flavors. And they say, well, far out. Let me taste some of this and some of that. Well, I didn't know you had that. Okay, so, I mean, imagine you're with a patient who plays sports. Okay, they play tennis and they have a weak psoas. Press the leg down and out. The weak TFL. Press the leg down and in, and it's weak. But they feel good and they go play tennis. Back and forth, short stops, fast forward. What are the odds that they're going to hurt themselves? Pretty good. Eventually, the odds are they're going to hurt themselves. If they knew that, might they want to do something about it? And the answer is yes, they would. They just didn't know it because no one ever told them. So I'm going to do my tests, right? If you do brain work, right? If they knew what was going on and how it was affecting so many things in their life, might they want to do something about it? Yes, they might. They just didn't know that you do that because their last doctor didn't do that. Right? So we owe it to them to just simply help them understand the truth, what I could actually do for them. Then I'll find out what they want and show them how to have it. So in the report of findings, find out what they want in relationship to what you can do for them, show them how to have it. So what happens? What happens if people are not getting enough care? Think about this. What happens if somebody really needs to be coming in, say, 3 times a week, but they're only coming in twice a week? Or they're only coming in once a week? Or they're only coming in once a month? Are you going to be able to get them the results that they're hoping for? And the answer is no. By definition, if they need 3 and they're only getting 2, maybe they'll still get there. It'll just take a long time, or maybe they just won't get there at all. Those are real things. So again, we owe it to them. They need to understand that if they're not getting the quality care and the how often they need to be coming in, that they will progressively worsen over time. Again, the odds are they'll progressively worsen over time. I don't even want to get into all the neurology and brain stuff, but let's just look at the bones. If the bones aren't gliding and they're grinding, they're going to lay down calcium. They're going to degenerate. They're going to fuse. That is what's going to happen, right? So again, you've got a weak psoas, you have a weak TFL. That whole guide wire system isn't working. They're not gliding. They're grinding, and eventually it's going to cause problems. So when we do this and we have people coming in, and as soon as they feel better, they stop and just come back in when they're in pain, they are progressively functionally worsening. Now, do those nerves that go to those muscles that affect those joints, do they also go to organs? Well, of course they do. Of course they do. So across the board, these people can progressively be worsening until we get them to the point where they're past the point of no return, where they're now past the point of us being able to actually help reverse it or get them to the point that they're actually healthy. Maybe the best we can do for them is help them feel good while they're progressively worsening. Right? It just depends where they're at in the game. One of the little metaphors that I like to use, I used to skydive a lot. And so I would talk about like a student canopy would be like 240 square feet, big canopy, right? You're coming in really slow so you don't do something stupid and kill yourself, right? When you're more advanced, you're like on a 120 square foot canopy. You're screaming in. You're coming in really, really fast. So let's look at somebody that has real damage that you're really not going to be able to correct. Is that possible that someone will have damage you're not able to correct? For most of us, the answer to that is yes, it's true. Okay, so the deal is that if they're on a 240-foot canopy, they're coming in slow. They're still coming down. It's still progressively worsening, but you've dramatically slowed it, right? Compared to if they didn't have a canopy at all, right? That's something different. So even if they're at the place where they do have a lot going on and you don't really think you're going to be able to resolve it or reverse it, you can still dramatically slow the process if you believe that that's true. And again, I think we need to let them know the truth and consequences of their choices. So, is it your job to tell the truth and consequences? Yes. Personally, I think it's malpractice if we don't. It's their job to decide what they want to do about it. Your job to help them understand the truth, their job to choose what they want to do about it. Now, it's your job to choose if you want to accept their care, right? So if they don't want to get towards optimal health and they only want to get feeling better, you can say, far out. Here's what I'd recommend you do. Or you can say, I don't do that. Let me refer you out. Either one is fine, but I think we owe them that much. Um, in the recommendations, I'm going to let them know. I'm going to recommend about this many visits over this period of time. This is how you should be feeling subjectively, and this is what we should see objectively. And after that, we'll do re-eval, re-report. And then we would go to about this much care over this period of time. Now, one of the things I get my doctors to start to understand is if the person is actually getting healthier, should they most likely need less care over time? Yes, to a point. So when I want them to know that when you come in, we'll know we're going from 3 times a week down to 2 times a week because you're coming in with little to nothing to do. Now, I know that for most of us, that's a new concept. Many of us don't believe it because we've never seen it, and we haven't seen it because you haven't given them anywhere near enough care. Because as soon as they felt better, they stopped and they were not functioning at all. Again, somebody feels good, but their psoas is still blown out. They're not functioning well at all. So if you're helping people function well and you have the skill set to tell whether or not they're still in process, like you can always make a cracking sound, but are you adjusting a subluxation versus a compensation? Like these are really meaty discussions that I have with my coaching clients. Okay, so the other discussion that I like to have with people, and I'll oftentimes tell them when we're looking at this about what they want, is I'll say, a patient comes in and she says, I want to have a baby. And I say, okay. And she says, but I don't want to take 9 months because I have a holiday coming up in 2 months and I want to bring my baby along. So I want to have the baby in 2 months. And I say, well, I can't I can't help you have your baby in 2 months. It takes 9 months. And they say, well, no, that's not going to work. I want it in 2 months. Now, if a patient said that to you, would you say, okay, I'll try? If so, in my world, that's malpractice. In my world, we need to say, I'm sorry, I can't do that. You'll need to go find somebody else because I'm not the right guy, right? What I will tell them is I can't give you a human being baby, but I could give you a puppy. I could get you a puppy in 2 months. And they go, a puppy? Far out. I would love to have a puppy. And I go, great. So let's do it. So I want to get as healthy as I can get. Well, I think it's going to take X amount of time. We'll just call it a year to get as much correction as possible or as much level of health as whatever it is. Great. And they say, well, I don't want to do it in a year. I want to do 2 months. Well, I can't now say, okay, I'll still get you here. I have to say, I can get you a puppy. I can get you towards here. That's my job. Well, I don't want to spend 2 months. I want to spend 3 weeks. I could get you a mouse. I can get you a mouse in 3 weeks and get you a puppy in 2 months, right? Stories, metaphors, especially if people laugh. It gets past the reptilian brain in the limbic system. So those are some of the things that I think might help you out. Again, in the end, I'm going to meet with them. I'm not going to fight with them. I'm going to let them know if there is more than meets the eye. I'm going to let them know. I'm going to find out what they want in relationship to what I can truly do for them. And then I'm simply going to show them how to have it. I hope you found value. If you have comments, please let me know. If you have questions, please let me know. If you think that someone else you know might find value in this, would you do me a favor and send that to them, please? And if you're looking to grow your practice in this kind of a model where you help people get healthy and stay healthy versus just getting out of pain, I can help you do it. As always, much love and aloha. Bye, gang.